Hi, I'm Bob Schrupp, physical therapist,
Brad Heineck, physical therapist.
and together we are the most famous physical therapists on the internet. I say with enthusiasm.
Yes, in our opinion, of
In our
course.
opinion.
But it's a good opinion, and today, Bob, what I want to talk about is foot pain. A lot of times it's diagnosed plantar fasciitis, whatever the diagnosis is. We're talking about pain that you can got this, Nancy, on the bottom of the foot. You'll feel it here. A lot of times right around the heel. Right now I have a patient diagnosed with it. Her pain is actually more on the arch right here. A lot of times the doctors will say there's a bone spur in there, and you want to get it treated. Obviously you don't want to go in there and get the bone spur out surgically. It's typically not an option, and that's good because there's a lot of conservative things you can do to minimize that. Now, one thing that you probably heard of, and that's why you're watching this video, is you can tape your foot. And how do you tape your foot? Now, the technique that I'm using, there's a lot of variations on how to tape, but this technique I found it useful in the clinic. Right now, a patient of mine is wearing it very successfully, and she's very happy with it. So I'm just going to go start into how to tape it. I'm going to use a two-layer tape. Okay, here's the bottom layer, and then the top layer.
Yeah, this is generally this is a hypoallergenic tape. It's really easy on the skin.
Sure, yeah.
So you usually won't break out from it, and that's the purpose of using the two layers, right, Brad? I mean,
Right.
one is to try to protect the skin, and the other one is actually kind of providing the strength.
Mechanical strength.
Mechanical strength.
Exactly. So do not do this if you have any history of being allergic to any adhesives, from Band-Aids or anything else that sticks to your skin.
Could even be latex too. Some of them have latex in
Yeah,
them.
so you just, if you have any history of being allergic to things with your skin, you may want to not do this.
And you might know right away too, if it starts getting red or itchy, you're always going to want to remove the tape.
Right,
I mean,
exactly.
Right away. You don't wait around.
Get some soapy warm water, take a shower, get it off. What I have here is just a simple alcohol wipe, and it's just to get the oils off this ticklish, huh? Oh yeah, it's not so bad when it's not a real patient. I don't care, Bob. But you can just use alcohol, rubbing alcohol, just clean the skin up a little bit, and that will be all it takes. Let it dry off, and then take your first layer of tape. Now, this typically has, I'm going to need my glasses for this.
I didn't even look at this stuff. How is this? Oh, it looks like it just one of the slit down the middle.
Yep, right down the middle.
This is a newer tape we're trying.
Yeah.
You
Okay.
want me to get it for you, or can you get it?
No, I can get it, Bob. I might be 50 years old, but I can still peel my tape. There we go. And this is pretty typical. It comes off in twos. There we go. Now, what I'm going to do is start on the back side of the heel here. Come around the back, about an inch or so, and wrap it around up towards the great toe.
You're going what I would call the outside of the heel, right? I mean,
Yeah,
on the,
sure.
because if this is
Medically, it's the lateral side.
yeah, if this is the other foot, it would be the side that it's closest to your arm.
Right. Now I'm going to put some tension on it. Okay, and pull it, not real tight, but snug. And then I'm going to pat it down, rub on a little bit. How you doing, Bob?
Good.
And keep in mind the person's foot should be in neutral. In other words, not pointed down like this, but have the person pull up a little bit so it's like they are when they're standing.
So it's a right angle.
Yep.
The foot and the leg form a right angle.
Right there. Right, Bob.
Right, correct.
Oh, it's killing me. Okay, now we need to. I've had success, and I think Bob uses just this, right? When you have
Yeah.
success with just one piece of tape here and putting on the mechanical
Yeah.
strength tape over it. What I found is that sometimes it's helpful to put another piece of tape, and we're going to do that. Oh, sticky, sticky. I'm going to start here. We're going to go around the arch. Now you want to try to avoid wrinkles. Wrinkles are not good. Okay, and we're going to go right around here. And this, you want it snug but not too tight. And we're going to wrap it right around a complete circle. Okay, and pat it down. Now sometimes, as a matter of fact, the person I'm working with right now, I did it this way. She came back and she just loved it. She wanted more support, so I put 2 layers or two width of the tape going across the arch. And it's all,
You really gotta make sure that's not too tight, because you could actually cut off
Yeah.
circulation there. I mean,
Exactly.
the one that goes all the way around.
matter of fact, what I did with her is I had her stand up, because that's when you're gonna find out, when you stand up, your foot splays out, and it'll be amazing how much tighter that gets. So if you start
Right.
out tight, and you'll know it, it feels tight, and if you leave it on, you're gonna have some circulation issues, it's just not good. But you can feel it. All right. Can you see what I'm doing, Nancy?
Yep.
Okay, so we're gonna go here.
Now, that piece of tape is going over, you know, the piece of tape you already laid down.
Right.
Again, the one tape is to protect the skin, this is the one that actually kind of really pulls on it and gives support.
Yep, this is very rigid tape, it has no flexibility in it, as opposed to the other has some flex and it can breathe, okay? Now, this one, I'll start here,
You're starting on the top of the foot.
top of the foot, and we're gonna go, now this is the one where you really do not wanna get too tight with. I usually just get it so there's no wrinkles in it, a slight tug, not much. Gonna come all the way around. If you get a little wrinkle in it, it's not bad. A lot of times you can just wipe it off with your hand, with your fingers. Come around, lap it. Lap it, not lap it up like a dog. Okay, sometimes my humor is incredulous.
The mind of Brad Heineck.
Yeah, okay, so we're gonna do this. Okay. Now, Bob, why don't you stand on that and tell me how it feels? Yeah, pull, yeah, look at those legs. Okay, how does that feel, Bob? Do you feel that
Feels
support
good.
you there?
Yeah, actually what it does, it does give some arch support, is what it's doing.
Yeah.
So it's holding the arch up.
Now, if you're having pain in this area, and you do this, you should immediately feel relief. When I did this with that person I'm working with now, I put it on and she said, oh, does that feel better? She could walk without a limp. Without it, she limped. With it, no limp. Literally.
Right.
And then,
Well, if I were to just say, I mean, there's a lot, like Brad said, there's a lot of different taping techniques.
yeah,
And it's a hit or miss thing to some extent. Once you say,
yeah,
I've tried this with people and they've hated it. I mean, the one I've tried, and I've tried people and it was a miracle.
yeah, it won't work every time, but
Yeah.
when it does. And
This
another
actually
thing,
feels really good.
if it works, if you find success with it, obviously you're not gonna tape yourself forever. You'll tape yourself, do some other treatment. The PT can do photophoresis, iontophoresis. They'll teach you how to use ice on it, etc. One of our videos, foot pain video, tells you the other things you can do with it. You should only be taping it for a few days. The inflammation should be down by then. You don't need tape. However, if taping helps, it might mean you need an arch support in your shoe. So you can just buy a standard across the shelf, insert in your shoe, and that'll take it'll support just like the tape does. It takes the place of the tape. It's a diagnostic tool to find out if you do need arch supports in some cases.
And I would generally say, Brad, is you can't keep the tape on more than 48 hours.
No.
And you can shower with it on,
Yeah.
especially if it's that heavy stuff. But after 48 hours, you take it off, no matter what. For one thing, it's probably stretched out by then.
Right.
It's probably not doing the job anymore. And secondly, you want to look, as you start to untape it, you want to look and see, is the skin red at all underneath it?
Yeah.
If it's reacting at all, you're not going to be able to retape it until that skin is actually clear again. So.
I did tape one person. She didn't know she was allergic, and she was, and it was a nasty red.
Yeah, I think we've all had that. I mean, we use the same tape on the knee. There's a very cool technique for doing knees with
Sure.
this. And I had people that actually we taped for weeks, it was fine. And then like the fourth week, where we were just about ready to get
Sure.
done with it, she just broke out, like you
Yeah.
said, nasty red,
Yeah.
cleared up eventually, but it's amazing how it can sneak up on you,
Yeah.
even when you think you're past it all. So, this feels really cool, Brad. It does feel like it's pulling on my.
Yeah, it's a nice technique to do, and it can really be effective. So foot pain, tape, they can work together. So if you're 40 and over, even if you're under, but 40 and over group, man, a lot of these techniques are really helpful. And sign up our subscription.
Subscribe.
Been
Subscribe.
talking long enough, Bob. We
Yeah.
better get off the air.
Sounds cool.